So today we will be discussing about the topic types of dentine in the chapter dentine. So as we all know, dentine is the second layer of tooth. So dentine comes between the enamel and pulp. Dentine can be of different types. So in the last class, we discussed about the composition of dentine, that is the physical and chemical properties, and dentinogenesis, that is the process of formation of dentine. So today we will discuss the types of dentine. So dentine can be broadly classified into three: primary dentine, secondary dentine, and tertiary dentine. Primary dentine can again subclassified into mantle dentine and circumpulpal dentine. Then tertiary dentine subclassified as reactionary dentine and reparative dentine. So all the dentine which is formed from the bud stage till tooth eruption and root completion is known as the primary dentine, whereas the dentine formed after root completion is known as the secondary dentine. Then dentine formed after the during tooth due to any pathological condition or insults like dental caries, presence of bacterial toxins, heat, cold, etc. can cause changes in pulp, which can stimulate the odontoblast to form dentine. So that kind of dentine is known as the tertiary dentine. So today we will discuss about this broad classification of dentine into primary, secondary, and tertiary. So all the dentine formed prior to the root formation is known as the primary dentine. So whereas a dentine produced after root formation or root completion is known as secondary dentine. So any kind of dentine formed after all the primary and secondary dentine is formed due to the presence of any external or internal stimuli is known as tertiary dentine. So we will look in detail on each type. So dentine that is formed prior to the eruption of the tooth is known as the primary dentine. So this is tubular in nature and the dentine lacks any cells. So this dentine consists of dentinal tubules. So they are secreted at a relatively higher rate, and the primary dentine forms the major part of the dentine in every tooth. So primary dentine can again be classified into mantle dentine and circumpulpal dentine. So the dentine immediately below the dentino-enamel junction is known as the mantle dentine, and this is the first formed dentine in the crown underlying the dentino-enamel junction. So the characters are, they are regular in structure, and the dentinal tubules are in S shape. So they form an S shape due to the result of the directional movement of the odontoblast. So it is the outer or the most peripheral part of the primary dentine, and is about 150 micrometers thick. So the S shape is formed as the odontoblast change in direction as they move. After each layer of dentinal tubule is laid, the odontoblast will move backward towards the pulp. So that is why they have an S shape. So immediately below the mantle dentine is the circumpulpal dentine. So just as the name suggests, it circumferentially seen towards the pulpal aspect of the dentine. So it forms the remaining primary dentine or the bulk of the tooth. So the fibers in circumpulpal dentine are much smaller in diameter when compared to mantle dentine, and the fibrils are closely packed together. So circumpulpal dentine has more mineral content when compared to mantle dentine. Moving on to secondary dentine. So all the dentine which is formed after the root completion is known as secondary dentine. So it is a narrow band of dentine bordering the pulp. So secondary dentine has circumpulpal dentine of the primary dentine on one side and the pulpal aspect on the other side. So it is a narrow band having fewer tubules than the primary dentine. So they also have a bend. So there is a bend in the tubules where the primary and secondary dentine interface. So the two bends, the primary and secondary bends in the dentine, give the characteristic S shape to the dentinal tubules. So since they are formed after erosion, the odontoblasts slightly change the direction, so which contributes to the bending of the dentinal tubules. So this dent usually helps in identifying the interface between primary and secondary dentine. So in this picture, you can see that there are two bends giving the characteristic S shape. So the first line showing near the DEJ is the mantle dentine and the circumpulpal dentine together forming the primary dentine. And the second bend giving the interface between primary dentine and the secondary dentine. Now we will move on to tertiary dentine. So what is tertiary dentine? So by pathological process or operative procedures like caries debridement, use of high-speed diamond bursts, heat can be generated. Or in some tooth, due to the use of excessive cold and hot fluids or food, heat or cold can be generated which acts as stimuli. So the stimuli causes the odontoblastic process are affected, and the odontoblast, according to the extent of injury, can either die or survive the injury. So two scenarios can be formed due to the insult. The odontoblasts either die or survive. So if the odontoblasts survive, so the odontoblast at the expense of the pulp will make new dentine. So that kind of dentine which is formed in reaction to a stimuli by the already survived odontoblast is known as the reactionary dentine or the regenerated dentine. So it is called a reactionary dentine as the dentine is formed as a reaction to a stimuli, or it is also called regenerated dentine. So in some instances, due to the extent of the injury, if the injury is very high, the odontoblast can die or they will not survive well. So in those cases, the odontoblasts who did not survive are replaced by new cells. So the pulp will stimulate migration of undifferentiated mesenchymal cells from the pulp, from the deeper layers into the dentine pulp interface, and the undifferentiated cells are differentiated into odontoblasts. And these new odontoblasts can produce new tertiary dentine. So this kind of dentine produced by newly formed odontoblast to seal off the zone of injury as a healing process is known as the reparative dentine. So after reparative dentine formation, there will be a resolution of the inflammatory process and removal of all the cells. So this kind of newly formed tertiary dentine by the newly recruited undifferentiated mesenchymal cells which regenerate to form new odontoblast is known as reparative dentine. So this is produced by a new generation of odontoblasts like cells in response to the stimulus after death or non-survival of the original odontoblasts in that area. So the activation is done by the pulp. So this kind of reparative dentine has fewer or more twisted tubules than the normal dentine. So histologically, mild difference can be seen between the reactionary dentine and the reparative dentine. So one among them is the reactionary dentine is deficient in acid protein. So it will cause a deficiency in staining. So the reactionary dentine will not stain as compared to the reparative dentine. So another difference is reparative dentine has a structureless mineralization, and the reactionary dentine appears either as a osteodentine type or orthodentine type. So they can be either osteodentine type of dentine or orthodentine type of dentine, whereas the reparative dentine has structureless mineralization as seen in bone. So that's how we can histologically differentiate between reactionary dentine and reparative. So both these are part of the third type of dentine known as the tertiary dentine, which is formed, the dentine which is formed as a result of any stimuli. So in this picture, you can visualize this tooth. In one area, a mild stimulus has been occurred, and in another area, strong stimulus has occurred. So in the area where the mild stimulus has occurred, the stimuli will cause injury to the odontoblast, but the odontoblast survived the injury, and there will be upregulation of the signals, and the surviving odontoblast will start producing new dentine at the expense of the pulp space. So that kind of dentine formed is known as the reactionary dentine. So the dentine is formed as a reaction to the mild stimuli, whereas sometimes the stimuli will be so strong that the original odontoblast cannot survive the injury. So in those cases, the pulp will activate the undifferentiated mesenchymal cells. So the recruitment of the cells, and they are differentiated into odontoblasts, and the newly formed odontoblasts will produce new dentine. So that kind of tertiary dentine is known as the reparative dentine. So the reactionary dentine and reparative dentine together constitute the third type, or the tertiary dentine. So apart from the primary, secondary, and the tertiary dentine, which we classified on the basis of time of formation, dentine can again be classified into other types according to the position, that is, and the relation to the dentinal tubules. So the dentine can be subclassified as peritubular dentine, intratubular dentine, and intertubular dentine. So just as the name denotes, any dentine which is seen on the periphery of the dentinal tubules is called the peritubular dentine, and the dentine present inside the dentinal tubules is known as intratubular dentine, and all the dentine which is present between the adjacent tubules, or all of the area between the different tubules, are known as the intertubular dentine. A few other types of dentine has also been identified within the dentine. So they are the predentine and the interglobular dentine. So predentine is the first formed unmineralized dentine. So the matrix which consists primarily of the organic matrix which is unmineralized is known as the predentine. So when dentine is formed, the odontoblast first lay a matrix dentinal part which is not completely mineralized. So that dentine is known as the predentine. And the second type is interglobular dentine. So we will discuss in detail about predentine and interglobular dentine in the upcoming classes. So reference for this is Orban's textbook, 10 Gate, and textbook of biology. So refer the textbook, and this is the classification. So basically dentine is classified into primary, secondary, and tertiary dentine. So coming to the assignments. So here, after learning this topic, you should be able to answer the following questions. Enumerate types of dentine and describe in detail each one of them. Then another question that can be frequently asked is classify dentine and add a note on tertiary dentine. So these are your learning objectives from this topic. So the assignments are, one is concept mapping. So as an assignment, try to construct a concept map on the types of dentine, its formation, structure, functions, and features. So the concept map should contain all the components. So Then second assignment would be the critical pedagogy. So try to learn the chapter after looking up at the reference textbooks and try to give an account of the events that can occur in the absence of tertiary dentine. So what will happen to the tooth if an insult or an injury has occurred and there is no tertiary dentine? So give an account of that as critical pedagogy. So that brings to the end of the topic, types of dentine. Thank you.